I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We've had fantastic interviews all day long, and now we're very pleased to welcome Joan Harvey to our studio, Vice President, Consumer Health Engagement at CIGNA. Good to see you, Joan.
Nice to see you.
Well, you've got some very exciting things and products that you've launched over at CIGNA. One of them is One Guide. Why don't I give that topic over to you to introduce?
Yeah, well, so one of the things that we have seen in the healthcare system is that it's very complicated, and consumers are having a difficult time navigating and understanding their benefits and how to maximize the value of their health plan. And so, in partnership with a whole new team of folks that we have in our research and marketing areas who actually come outside of healthcare, we've really understood the profile now of what a consumer wants in their care. We have 5 moments that matter that are critical to them. And we use that along with design firms and folks that really understand how to build consumer products to try something different. Instead of a health plan just building a product that we think they're going to like, we actually involve the consumer in the research the entire way.
And where did you draw the experts from? You said outside of healthcare to help you build this.
So sort of a combination. We first of all have hired, David Cordani, our CEO, we've hired an entire group outside of healthcare to run our marketing and consumer research and consumer insights groups. So from Ford Motor Company, Pepsi, banking, and they bring such a different view of how to think about the consumer, which has guided our insight research, which drives that's what we need to focus on and staying true to that. We also have been using a lot of the design firms that do consumer design. There's a number of them out there, and they actively took that research that we had and said, okay, we want to build the product that we'll be talking about today is around navigation and concierge servicing of our consumers. But what do they really want when you're talking to them, and how do you build it and design for the consumer? And then we consumer tested the entire way. So we'd build something, we'd put it in market and try it. We'd build a little more. And we pivoted numerous times in the design of the product, but at the end of the day, it really got the stamp of approval for what the consumer said they would use and that would be of value to them.
Give me an example of something that they really liked and something that didn't work that you ended up changing.
So they really like mobile. Right? For simple things that they want to be able to touch. So I'll give the same example in the mobile solutions. They want to be able to answer the question immediately online, right? And in order to do that, we have to think about reverse engineering or reverse structuring the benefit book, right? So we say, here's your benefit book, go read 200 pages and figure out what you need when you need it. Well, when you answer their question in less than 3 seconds, you have to say, what is my physical therapy benefit and how do I use it? It has to go in, understand that, and serve that up to the consumer real time. So we had to restructure how we did it, which is a change that happened in the research. We couldn't do 8 or 9 steps to get them the answer. They wouldn't stay on if it was less than 3, basically. So that's sort of an example. They love mobile. We designed something that we thought they'd like. It was too lengthy in time, so we really had to restructure the execution of it down to less than 3 clicks, basically.
Wow. That's exciting work, isn't it?
It is. It's been very exciting.
Now, there have been a lot of different models that have been talked about here at this conference, direct to employer, payer type situations. Has the insurance industry really had to take a look at all these other models too, and are they concerned that the traditional one is going away?
I don't think that it's going away as much as it's evolving and we're changing how we partner. I don't think we're all going to fix healthcare in the macro state without using our assets all together, because each of us has expertise. Providers take care of consumers and health very well. Payers understand risk and financing. Employers have cultures of health and things that they want to bring to the market, and I think we can use each other's knowledge as a collective good. So I don't think it's going away, but I think how we partner and how we think about it and what we come to the table with is very different.
Okay. Now, what other partnerships do you think CIGNA might be looking at down the road?
I think, we are extensively involved in our provider groups. We have, over 150, accountable care organizations. We call them CACs in our world.
Okay.
And the thing that I think we're really focused on now in the introduction of One Guide is how do you take the employer products, right? Because employers are still the primary payers of healthcare, unless it's Medicare and Medicaid government paid business. And they have a vision and a culture that they want to bring forth, and thoughts about what kind of environment they want to create in their employer space. And then you've got now these risk-bearing arrangements starting to happen where the provider wants to get more involved. Like, oh, if I'm going to take risk, I want to be more responsible for my patient, and I want to be able to serve them really well. We have to convene those two together still, because they're paying for the service and they're providing the service and they're taking risk on it. And how do we allow the consumer to understand what those designs look like in a single place, understand how to navigate it, understand their benefits, understand what networks they're in, and a really simple solution. And that is the goal that we think we're bringing to the table, sort of that convening architecture, and thus One Guide as a product.
Sure. You're presenting at a couple of panels here at the Congress. What are some takeaways that you're really leaving with attendees?
Well, I think it's actually one of the keynotes said it today was, it's funny, it says, how do we not innovate and design for technology or design sake, right? I think it was mentioning that with equity jumping into the area, we have about 16,000 health apps and about, you count them on your hands, the ones that are actually actively used. We really have to solve the real hard problems, right? You can't just put a Band-Aid kind of architecture on it. You've got to get into the guts of how plans are designed and how care is administered, and really solve that in a different way. So it may not be as sexy and short range, but that's really where I think the results are going to be.
Right. And how have you been finding the experience here at the World Healthcare Congress?
It's been great. It's been great. There's such a diverse group of people and so many different, I think, tracks of information that you can learn all in one place. So we've really enjoyed it.
All right, Joan, thank you so much for your comments today. Really appreciate it.
Very nice to see you.
Thank you. And thank you for watching. Stay tuned, much more to come.